It's really fascinating because I was talking to a doctor friend the other day about the great increase in allergies in children's sensitivities. And part of what they were hypothesizing similar is that you take a benign substance and you're eating it in a stressful environment as a child. Let's say the parent is yelling, or suddenly it's some news thing comes on and it's stress. The body then sees that as stress. The immune reacts, overreacts to it. And then every time after, you have the memory, the trauma that's not released. And he was hypothesizing or saying basically that a large portion can come from that. When you take in certain substances, especially from starchy substances you normally eat, maybe some grains and things that are kids are normally sensitive to, even peanuts and other things, that if put in that environment of stress, the body sees it as that and then recollects that. And until you resolve that, it will continue to have the same overreaction or inflammation or anything else if you look at scars and everything. And that forms a chronic issue. Is that something you'd agree with in the neural therapy sense of looking at this?
Absolutely. I think the this new paradigm that includes fried circuits
Yeah.
triggering the stress response in an abnormal way includes the concept that there are things that trigger them.
Yes.
So it may be a food, it may be a change in the weather, it may be a scent,
Hmm.
but when you're more irritable, it takes less to trigger that stress response.
How are you identifying them? Because I know there's different ways, and a person listening saying, well, I don't know where my blockage or interference field may be. How does one then locate that? Because I know there's a number of ways. How are you doing that?
Well, you can do this yourself. Um, in my practice, started out creating a table.
Mm,
How old were you? What happened? Which part of you was affected? And what was the nature of the sort of the complications? What made that event special? So, running through the list of any bones you've ever broken, any surgical procedures you've ever had, any lacerations, sprains or strains, any dental procedures that were invasive, root canals, wisdom teeth, that sort of thing, uh, any recurrent or chronic infections that you have had throughout your life, even in childhood,
mm,
ears, sinuses, tonsils, lungs, recurrent cellulitis, intestinal stuff. Those are all places where, we think of a patient who has recurrent bladder infections and we just keep treating those infections without asking ourselves why the infections keep coming back. Did we fail to eradicate the organism? Well, no, you have a sensitive bladder because the nerves that supply the bladder never recovered from the first bladder infection. So, in terms of knowing what might be an interference field for you, it's helpful to start with a complete list. I'm putting together a service I'm calling the body map so that any
mm.
provider can get a PDF report that makes it easy to see where a patient has had interference fields. Some of my patients have had, 20 or 30 events that might scar them. And traditionally in neural therapy, there's been a lack of consensus about how many interference fields to treat in one visit, how to select which ones are more important.
Mm.
Some classically trained doctors from Europe will treat every interference field at every visit to make sure they don't miss any. Some will take a reverse chronological approach.
Mm.
So, starting with the most recent injuries and then working their way backwards, all the way to birth trauma.
Yeah, no, it's fascinating. And again, you get into the artistry of it, and each person's different. Some do kinesiology to try and see which ones are bioresonance or EAV testing, right? And there's so many
Exactly.
different ways, but I think just the concept alone is game breaking because anyone that's ever had any scar tissue, you said it, I think one of the biggest ones is either dental, you get your wisdom teeth pulled, or in your mouth again, tonsillitis, you get your tonsils removed, right? You've probably seen this where you're doing those neural therapy injections, which are kind of trigger point like injections into that area to resolve those disturbance feel, that interference feel and blockage, correct?
Well, it's interesting because many patients will say, well, my tonsils are not a problem because I had them removed.
Right, right.
But when I tell them that the nerves are still there,
Yeah.
and that those nerves might be sensitive, affecting lymphatic drainage in the head and neck, potentially contributing to symptoms like brain fog or sensitivity to sense. The concept that most of how we interact with the world, our senses, are mostly above the neck, right? So we have lots of ganglia above the collarbones, and many of those chronic Lyme, chronic fatigue, fibromyalgia, mold, MCAS, chronic mercury toxicity. Many different monikers have been attached to those patients who are tough to figure out. And a lot of them just have interference fields.
Yeah. That is such an initiation point that's missed often, apparently, definitely by conventional side that don't even recognize these things.